Taking a fresh look at some new clinical evidence from omega-3s reducing post-surgery infections by 58%, to herbs showing real promise for fatty liver disease. Also, basil, can it reduce your blood sugar? We'll take a little bit of a look at that and a whole lot more. So let's get into it. All right, so where I get a lot of my research from is I get a lot come through my inbox from different journal articles and so forth, but examine.com do a roundup for me once a week. So what I'll do is go through their articles and see if anything is relevant, and specifically for something like this today, that might be relevant not only for you out there listening, but for a lot of my patients who I might be already using things like omega-3s, collagen, specific herbs, and some of the insights that examine.com give me can be good discussion points as well, because I don't necessarily agree with everything that they recommend, and research gives us a lot of great information to act on, but it is a very narrow perspective when we look at the broad scope of herbal medicine as a whole, and clinical nutrition, and the rich history we have of diets and nutrition, and especially herbal medicine. So let's bring up the studies in question, and I'll just, and bingo, I think we're there. All right, so this is the study summaries here, and we'll jump right into the main one that we want to talk about today is omega-3, and we'll go straight to the gut health section. And omega-3 fatty acids support recovery after gastric cancer surgery. So this is a bit of a surprise to me, actually, using omega-3s in this context. Usually with omega-3 fatty acids, they don't like people being on omega-3s with surgery because of a high risk of bleeding and so forth. So when I see something of this nature, it's a little bit of a surprise to me, and really the outcome is incredible. Like, we're reducing the infectious complications by 58%. That's incredible. And we've got shortened hospital stays by average 1.3 days, which is also a great thing as well. So let me just see if I can get a highlighter here as well, so we can highlight anything we need to. So they receive the usual nutritional support through feeding tubes, and then the individual groups also got the omega-3. Now, I don't see the dose isn't here, but I have looked at the original study, and I believe it was around something like 800 milligrams of omega-3. Now, this is quite low. When we look at omega-3 dosing, we usually talk about in the realms of 2 grams of EPA and DHA. So EPA and DHA are the components of the fatty acids, or the specific fatty acids within the omega-3 group that we want to get the action on the anti-inflammatory action, and also to improve cognitive function in many cases. So these fatty acids in particular will initiate anti-inflammatory mediators, anti-inflammatory components, and eicosanoids, of these sort of things that will do the work, and they're working on multiple levels in the immune system, from platelet activation to what we're seeing here with CD4 lymphocytes and also CD8 lymphocytes. So they have this balancing effect, so immunomodulation effect. So this is very important, and this study I really wanted to highlight the importance of omega-3s with, because when I see patients, they come in, and one of the things I look at when I'm looking at their diets is, how much omega-3 is in their diet. Do they have adequate amounts of omega-3, or are they, not getting enough, and do we need to supplement? And I often push for dietary intake, increasing dietary intake of omega-3, and then from there I assess whether it's relevant to go higher dose, and like I said, up to that 2 grams of EPA and DHA. So omega-3 is incredibly important, and just recently I had a patient where I tested his fatty acid status. So that was omega-3s, omega-6, saturated fats and so forth on a cellular level. And the concern was that he really wasn't having much in his diet, even though we tried to get his omega-3 up through dietary means, like things like sardines, mackerel and anchovies. Now, let's face it, not many people like a lot of those fish. Some people do and eat them regularly, and that is great. It's a great way to get your omega-3s. And there's things like salmon, and if you're a vegetarian, you might be looking at things from walnuts, flax seeds, chia seeds, and other nutrient sources. You can go algal oil, which is a good option, because that'll have the EPA DHA, whereas some of these other ones you've got to convert the omega-3s into EPA DHA, and that can be problematic, and you just won't get the amounts that you will get when you have the fish in your diet. So he wasn't getting enough omega-3 in through the diet. This is just from my analysis. And he, like a lot of my patients, they like the functional testing or any testing that can really show specifically what's going on, what's needed. So we did that for omega-3s. Now, it came back and he was just in there's kind of like 3 levels, depending on what test you get and how they present it, but he was in really the just adequate amounts, just getting in there. And when we looked at all the results of all the different fats in his diet, and this is on a cellular level, it was clear that whatever omega-3s he was getting wasn't enough, certainly to have an anti-inflammatory action or any therapeutic effect. And I think this was important in this particular case. And this really indicated, the results of this test really indicated, and clearly indicated to him too, that, hey, look, I think you'll benefit from having supplementation. And we're now doing that. And this will help with his gut health. It will also help with his skin health, 2 things we were treating. And as you can see on this study here, that it clearly shows that it has much more positive ramifications throughout the body, especially the immune system. So if you're not sure on your omega-3 intake, now they're essential too. If you don't know what essential fatty acid means, essential means we cannot make it within our body. We have to get it from the diet, external sources. So you need to really consider, are you getting enough omega-3? Because if you're not, this could be having a profound effect on your health. Now, in addition to the health benefits I've just covered there is evidence to suggest it is fantastic for longevity, increasing telomere length. So when we're looking at our DNA and so forth, there's a lot of benefits there too. So when we're looking at a building block such as essential fatty acids, or in this case omega-3, EPA, DHA specifically, they're building blocks on a cellular level. We've got to think, how does that play out long term, especially if you end up in a situation where you are deficient or have insufficient amounts. So a great study. Is there anything else I wanted to talk about with regards to the study itself? And look, this outtake is something that Examine.com offer, and they mention here the results were encouraging. Future analysis indicated that the evidence for reducing infectious complications was strong and did not appear to be limited by insufficient data. So what they're saying here is, even though it would be better to have more data, the limited data that was there was showing accurate results. Because I also took a bit of a deeper dive into what they were referring to here, and they also looked at when you do a meta-analysis, there can be certain trials that get into that meta-analysis that aren't of as high quality, as some of these other trials. So sometimes it's good to go, okay, what if we take out these poor quality trials and look at what the higher quality trials are telling us? And that's what they've done. And also we get the same results here. We're getting this benefit of reducing post-infection by 58%, which is fantastic. Okay, so let's move on to the next study here. And all right, immunity and disease. Okay, so this was vitamin D, one of my favorites. If anyone's been following me for some time, that vitamin D is critical. Now, I do a lot of autoimmune cases, and I have a lot of autoimmune patients, and it's very important that vitamin D is right. And vitamin D has like what we call an immune modulating, so immune balancing effect on the immune system. And we know with autoimmunity, it's an imbalance and there's lots of inflammation. So vitamin D directly impacts that. And I have seen time and time again where we can get a lot of cases right with the treatments we're doing with, say, if it's rheumatoid arthritis, if it's psoriasis or other immune things. There's a lot of things you're doing to treat the symptoms as well as try and turn that condition around. And if you don't have the vitamin D right, you're battling uphill and you're not going to get success in that treating that patient. So you've got to have the vitamin D right, and that's got to be specifically tailored, and there's got to, you also consider a lot of these other nutrients that support vitamin D. So K2 is often mentioned, but there's things like magnesium. Vitamin A is often something that's overlooked, and I look into that for supplementing. And again, that has immune modulating effects or immune balancing effects. So in this particular study, there was a meta-analysis again, and it was in Africa, and they were giving vitamin D to see if it improved overall health. Now, as exam.com mentions here, the improves general health. There's little in the study to show it improves general health, though what was particularly interesting in this finding is that the participants who had HIV who received vitamin D had 1.63 times greater odds of achieving HIV viral suppression compared to placebo. So again, working on that immune system. And when we look at the amounts given here, anything from 4,000 IU to 200,000 IU per week, there's a lot of variation here. So I think what's been included in this meta-analysis, if you were to take a deeper dive and know what you're looking for, I think you'd see a lot better positive outcomes in relation to vitamin D here. So I just like to point that out when I come across some of these studies, because even though it's a meta-analysis meant to be top of the food chain as far as quality of research goes, it can include studies that may not, that may stray the results of the meta-analysis and may not give us a true indication of how beneficial something like vitamin D is for health and in general health, because this study obviously doesn't reflect that it was good for general health, more specific to the viral health. But again, I think you'd have to take a much deeper dive and look at study by study, and look at the flaws and the pros and cons of each study. All right, so moving on, the next one I've got highlighted here is a collagen. Now, collagen is something that's been a bit of a buzz around for some time now, this last decade, especially in the last 5 years. And there's a lot of collagen supplements out there that are really super expensive, and they're of poor quality and so forth too. So I often recommend to my patients that they, if they can get the gelatin from bones. If you're vegan, that's not going to be appropriate. Though collagen supplements aren't appropriate for vegans in any way, but if you can get the gelatin and everything too, that can be really great for gut healing. But there's specific types of collagen that has been tried and tested in the research, and that's what I look for in the supplements or the collagen powders I prescribe to my patients, the ones that have been clinically trialed. And they're usually around 90% of protein, and they're rich in glycine and proline. That's the whole point of these collagen peptides. And these amino acids are known to work on the joints and connective tissue. And in this particular study, we're looking at before each session, the participants took 500 milligrams of vitamin C and either 30 grams of hydrolyzed collagen or placebo. So vitamin C is very good for connective tissue as well. So that's why that's been taken in this context here. And 30 grams, that's often I'll just take 15 grams of collagen. So 30 grams is a nice amount. And the increase in patella tendon cross-sectional area was greater in the collagen group. And how quickly maximum force output was achieved was higher in the collagen group as well. So this is important. I think it's a really good supplement for injury and repair. And, I use it a lot for gut health in that regards too, repairing the gut wall. But yeah, joint health, joint repair, it's fantastic, and really giving the joints that flexible tissue too, I think, and making joints more durable in the long run. Now you can couple this with things like glucosamine, chondroitin. You've got to get those dosages right. A lot of people will get a supplement with glucosamine and chondroitin. They'll only get, there'll be less than 500 milligrams of chondroitin. We know that 800, 900 milligrams of chondroitin is really the ideal amount for that. So if you're looking to get 2 grams of glucosamine sulfate, some chondroitin at around 800 milligrams, and some MSM powder, and you get the collagen, it is fantastic for joint health. Now also, this is where I might add in something like turmeric. I like the Mariva forms of turmeric, so the liposomal Mariva forms, which there's many companies that use that. And then your omega-3 fish oils, getting a high quality, getting to 2 grams of fish oil. If you were to do all that with collagen, repairing gut health, repairing joint health, you can get some amazing results. All right, so let's move on to the next research here. And before I jump into what I've got here from examine.com, I'll just stop sharing that for a second. I'll have to put my grandpa glasses on so I can see a lot better. Unfortunately, the two studies I've got here, they're out of a literal journal that just got sent to me the other day, and I haven't had a chance to get a digital copy, find them. So that's the Journal of Advances of Integrative Medicine. Now, you can see there, it's from the Australasian Integrative Medicine Association, which I was a member of. And I say was because they're not around anymore, but they're still producing these journals. This is quite a big journal that came out that's got a ton of stuff in it. And I really liked a couple of studies here that I wanted to talk about because, again, it's a meta-analysis, and I'll see if I can get it shown up on the screen here. So this is the specific one here that I'll be discussing right now. And so you can maybe see that all right, I don't know. I'll try and get digital copies up on the notes page when I do the notes for this podcast. And yeah, I really liked this meta-analysis, and it takes into account quite a few studies and it uses herbs, includes herbs that I don't necessarily would use in treating liver disease necessarily. But Philanthropus is in there. It's Beta vulgaris, Allium sativum's in there, Silybum marianum, so that's milk thistle. We've got garlic in there. We've got Nigella sativas used in there too. So Nigella, which is black seed oil, some of you might have come across that, cumin. And it's a fantastic herb that I've recently added to it's been made available in recent years. And look, I say recent years, it's been probably the last probably nearly close to 10 years itself. So, but there's a lot of new supplements that come out, and it's hard sometimes to justify utilizing them. But when Nigella came out in a liquid form for herbal dispensaries, I tried it. I thought, I'll see how it goes. But we know it can reduce histamine. It can have these incredible antimicrobial effects, but it doesn't really diminish beneficial bacteria. So I use it a lot for gut health. And it has blood sugar regulating, so that's where it's coming in for this liver health here, I'm assuming. I'd have to look at these at the individual studies. Why I wanted to talk about this study is that it's showing really positive results, and liver herbs often don't get talked about, and they're not often considered in they're definitely considered in clinical practice, but out there in the mainstream, treating the liver is such a traditional naturopathic thing to do. It's part of that whole digestive tract that we treat. So in improving liver function, whether it's the phase 1, phase 2 detox pathways, things like glutathionation, glycination, sulfation, methylation, these are all part of the detox pathways. And but protecting the liver too, the liver at the cellular level, these are what these herbs do. So milk thistle is mentioned in there. It can be what we call a liver trophorestorative. So it protects the liver and repairs the cells. So these are fantastic herbs, and they have multiple mechanisms that can not only help with the liver, but also help with many other systems at the same time. All right, so we'll go on and have a look at some more examine.com. Okay, so yoga may help reduce postpartum depression symptoms. Now, this is a big one for me because I often recommend yoga to a lot of my patients. And in this particular case, the participants practice yoga for 30 to 60 minutes, 1 to 3 times a week. And that is fantastic. And I wouldn't expect anything less. And even examine.com's take down here, the results align with other studies that demonstrate that yoga may reduce the symptoms of postpartum depression. Yoga, even if you stop to do yoga for 10 minutes, one session, once a week, it can have benefits. The reason for this, yoga is one of these things that bring you into the present. And I think anything that can bring you into the present moment is, in this day and age, very special, because we are so scattered, our attention spread across so many things. We've got future concerns, we've got concerns we worry about the past. It's very, very difficult to stay in the right frame of mind and really stay focused and achieve what we want to achieve. Breathing, doing physical exercise while breathing, which is yoga is all about, And I really highly value stretching as well. Again, yoga does this too. We could do a whole podcast on that alone. But those deep breaths, breathing in while you're moving, I cannot recommend it enough. And when we do physical activity, it is a great way to gauge where we're at with our health. Because, when we find our limitations, okay, why are we limited? What do we need to move forward? Or if we pick up something that we haven't done in a while and we go, oh, I can't quite make that stretch, or just a bit sore doing that. So these things I think are a great way to gauge our health in the long term, and also bring us back into the present moment and have this lasting calming effect. And we benefit in our sleep, our day-to-day life, and I cannot highly recommend it enough. And it's great to see some positive results here for mood and depression. And yeah, if you're doing things like yoga, Pilates, Tai Chi, things like that, you're going to get some really positive benefits. And some of these benefits will be things like mood and preventing anxiety as well. So, all right, so let's move on to the next one. Okay, so exercise and our friend Omega-3 again for menstrual pain. So here we go. This is a group that's doing 800 milligrams. So take back what I said about the other study. I may have got these crossed over in regards to dosages of Omega-3 here. However, there is a great result here. 12-week randomized controlled trial in 72 women with primary dysmenorrhea, ages 18 to 25. Aerobic exercise and omega-3 fatty acids seem to reduce menstrual pain. So again, for my female clients, I always stress omega-3s. Getting them in with the diet is important, but we might look at doing something like I said before, 2 grams equivalent of EPA DHA. So that would be a lot higher than 800 milligrams of omega-3. And that would really have a huge benefit on systemic inflammation in the long term. Omega-3s, I find, they take a bit to get into the system at a cellular level, do their thing. And I usually try and evaluate omega-3's impact on health at the 3 months mark, and usually we start seeing some real benefits, and then it's really long lasting. So the trick with omega-3s is when you start seeing results, don't then just come off them, because you will have sustained results. And this happens with herbal medicine as well, that you'll have these results that might carry on for a couple of weeks after you've stopped the intervention, whether it's herbs or in this case omega-3. But then symptoms will come back and you'll wonder what's happened. And so maybe reducing the dose is a good option at that time, but that's where you see a practitioner and you get the advice, and then you adjust dosages. But omega-3, whether it's diet or supplementation, have fantastic benefits as an anti-inflammatory, and in this case for dysmenorrhea, so painful periods. If you haven't tried it, really give that a thought, because omega-3, I've seen it do wonders for my patients who are suffering from menstrual pain, and it could probably do wonders for you too. All right, so let's move on to the next one. Handful of almonds a day nudges the cholesterol right away. Okay, or nudges the cholesterol the right way. Interesting. So almonds, well, look, nuts and seeds are something I try and get my patients onto straight away, especially for metabolic health. So again, something like almonds, if you're replacing a snack like a chocolate bar or something like that with almonds, you're going to have profound benefits from doing that, and especially if it's a daily habit. So I usually encourage not only almonds, but things like macadamias and cashews, and my favorites, pecans and walnuts are really, really good. So putting a little nut mix together can have lots of benefits. In this case, lowered cholesterol, and even looks like it lowered apolipoprotein B. So apolipoprotein B is a more accurate marker than LDL cholesterol. So if you're really wanting to get an idea of where your cholesterol's at, or if you're trying to reduce your cholesterol, I'd be looking at the marker apolipoprotein B. That's a much better marker. Now, without generating a huge argument, because there could be some of you sitting across from there saying, oh, but cholesterol doesn't matter anymore, Brad. You know, we can eat as much saturated fat as we like. That's, you know, some of the narrative out there. This is important to understand, that health is an individual thing, and something like cholesterol is like it's on a spectrum. Have people at one end of the spectrum that will be very reactive to cholesterol. It'll be very detrimental to their health. And at the other end of the spectrum, you'll have people that could eat and have an intake of cholesterol and be constantly high or above the markers that they'll have just slightly higher markers all the time, no matter what they do. And you'd think that'd be a concern, but then you'll get a CT angiogram. So CT angiogram's really it's the most accurate way to find out if you've got plaque, especially not just hardened plaque like a calcium score will do, but you'll see that soft plaque accumulating. So that's the most accurate way, and I'll have patients that have done these CT angiograms, and they're absolutely clean, and their cholesterol's been running high all the time. So that's at one end of the scale, but then you'll have people at the other end that are going to be at high risk, even if their numbers aren't above what they should be. They've got to really watch their apolipoprotein B, and they've got to keep that under 80, I think it is. But you can, by monitoring that specifically, you can really gauge it well and see how your interventions are working, whether you're using medications. Preferably, if you have to intervene, you're using things like psyllium husked almonds and other nuts and seeds, and things like garlic is great as well. So there's many things you can do if cholesterol is a problem for you. All right, so let's move on. Yeah, some really good results here. This was one of the picks of the editor's picks. The editor picked some studies, and there's a lot of mechanisms that they're looking at with this. So now, important note here: benefits are generally greater in people who start with a higher LDL cholesterol concentration. Effects also held up when looking only at higher quality trials, which strengthens confidence in the findings. And this is something I mentioned before, that when there's a lot of trials added to a meta-analysis, we want to test how solid the outcomes are by looking at the strongest trials within that meta-analysis. So if there's 20 RCTs, 10 of them might be okay, and another 10 might be, looking a lot more robust, but within that 10 there might be 5 or 6 that are really solid, big numbers, lots of participants, and then we might look at looking at those specifically to see if the results are reflected the same way. All right, so okay, this was one that came up too. So we looked at we didn't get a chance to really look at the study. I flashed it from the Advances of Integrative Medicine journal on the liver herbs and NAFLD, or non-alcoholic fatty liver disease. This is a herb Barberry that's been used as an add-on for metabolic syndrome. So metabolic syndrome is kind of like that pre-diabetic picture where we're on your way to diabetes, and you've got to really step in with some interventions or turn your diet and lifestyle around, preferably. Now, in this particular study, the participants took 75 milligrams to 10 grams of barberry, or 200 to 480 milliliters of barberry juice for a period of 3 to 12 weeks. So 12 weeks isn't that long. So we would expect you to get better results if you were going longer. But there's a lot of things that they tested here. And their take on this is barberry seems to be beneficial for cardiometabolic health. Now, what we got to understand here is that barberry is a herb, and there's several of them that has berberine in it. So you may have heard a lot about berberine. It's I think it's flashed across social media. Now, berberine containing herbs, we as naturopaths, as health practitioners who have learnt these herbs over the years, we understand that these may be a temporary intervention, because berberine can reduce bifidobacteria. It can have a positive impact on the gut microbiome if it's taking out a pathogen, but it can also impact your good flora too. So this is something to be mindful of if you're using any of these berberine-based herbs. Now, barberry in this case, they're not using high doses and so forth, and they're just using it as a 12-week intervention. But then you'd want to have a backup plan coming in saying, okay, what else are we doing? Or you're working on your diet and lifestyle in that time, and hopefully you get your diet and lifestyle to a place where that sort of takes over, steps in and go, okay, now I'm exercising more, now I'm eating a better diet, I can be off the barberry, or if you're having berberine supplements, I can be off the berberine supplements, and then you're relying solely on that diet and lifestyle changes to move you forward there. So yeah, very promising. Again, good outcomes here. Now they're saying that they say here, when I say they, I'm referring to examine.com. Barberry seems to be beneficial for cardiometabolic health, but the short intervention durations and low evidence quality of most of the outcomes reduce our confidence in these findings. Okay, and like I said, barberry is a herb that has berberine. You'd be doing a lot higher dose of berberine to probably achieve even better results than what's shown here, which we've got evidence of. There's other herbs like golden thread is a really high dose a herb that has high amounts of berberine in it, and that has been shown to be very beneficial for cholesterol management and overall cardiometabolic health. So maybe barberry is not the best herb to use in this circumstance, and maybe you would use straight berberine under certain circumstances, and you'd get even better results than what was seen here. Yeah, that was something that, given that we've spoken already on liver health and herbal medicine interventions, I thought that was relevant to talk about. And I always like to discuss anything berberine related. Astaxanthin. All right, this was popularized with krill oil when that came out as a alternative to standard fish oils. It's meant to have been a better absorbed option. Now, krill, it often had a lot lower EPA DHA, so even though it was better absorbed, but it had astaxanthin, so this compound here, and again, painting a better cholesterol picture. Now, here it says participants took 6 to 20 milligrams of astaxanthin or placebo daily for 4 to 12 weeks. Again, only 12 weeks. Now, remember I mentioned to you talking about fish oil or omega-3s, the benefits to that usually pop up at the 3-month mark, or even 3 to 4 months. So in this case, they're doing it for 4 to 12 weeks. Then I wouldn't expect much in between, at the 4 to 8 week mark, and then maybe 12 weeks we're seeing some results. But if you were to take it twice as long, I would expect you to see really good results. And it just had modest results here, but it did have pretty good ones. So again, another option in addition to things like omega-3, Berberine, we've just shown with low cholesterol. Astaxanthin can be a good option as well, and you can get it in the form of krill or astaxanthin as a straight supplement. But it does show a lot of promising effects, astaxanthin as a supplement by itself. All right, so Policosanol. This is interesting because I don't often see much research on this in recent years. It was a lot, it was popularized about 15 maybe 15 years ago. It was very popular, a big health shop item that sold a lot of. And in this particular study, participants in the Policosanol group, more in the Policosanol group than the placebo group, had a systolic blood pressure reduction of at least 10 millimeters of mercury. So 74% versus 12% of placebo group, and diastolic blood pressure reduction at least 5 millimeters of mercury. So 91% versus 15%. So quite significant. So I found that to be quite interesting because something it's kind of gone off my radar a little bit, Policosanol, but showing really good effects of reducing high blood pressure. And there's lots of things we can do with high blood pressure. So if that is something you do suffer with, try and get in with a naturopath. And there's so much you can do with that. Even some simple things like hibiscus tea has been shown to lower blood pressure. So there's many things that could be done to lower it. And more importantly, you want to work out why you've got high blood pressure too. There could be other things going on with your health that need to be addressed. So really important that you attend to that. High blood pressure is something you don't want to mess around with. All right, so and the Examiner.com is saying here, results align with other evidence that Policosanol can improve blood pressure, given the clinical significant effects reported. Given the clinical significant effects reported in this study, Policosanol may be particularly effective in people with high blood pressure. I would say definitely effective with people with high blood pressure. But again, you've got to. It's all individualized. This may work very well for a lot of people. But for a subset of people, it may not have a benefit at all. So that's why in many cases we intervene with numerous things, or we try and understand the underlying causes of your health issue and what's going on for you to address those specifically with the right supplements. All right, so, and Omega-3 pops up again on brain health for multiple sclerosis. So often, this is really important. I've stressed this is the third time now, about the importance of omega-3 in health. But again, DHA is important for cognitive function, brain function. So when we're looking at this particular trial, and it's a 12-week randomized controlled trial, 55 adults with multiple sclerosis, they supplemented with omega-3, and it didn't alter levels of brain-derived neurotrophic factor, BDNF, C-reactive protein, physical activity, or fatigue in comparison with placebo. Okay, so it's saying a result that isn't ideal. Now, supplementation with omega-3 fatty acids did not improve the measured outcomes in this cohort. However, the effects of omega-3 fatty acids on neurodegenerative diseases such as multiple sclerosis are complex and may be influenced by dose, duration, and fatty acid composition. Examiner.com, they're making a really accurate statement here, because there's a lot of other positive trials on omega-3's beneficial effects on cognitive function and neurodegenerative disease, and there's so many factors that contribute to if it's going to be successful or not. And multiple sclerosis is an autoimmune disease. It's very complex, so you've got to deal with the autoimmunity aspect of it, and the omega-3s may not be having an effect on autoimmune parameters that need to be controlled in this particular case. I think, again, it's something that if patients already have substantial omega-3 levels, then adding more may not help in this situation. And again, if they do need to add more, then they might need to add a higher dose. And then, are they absorbing it well? We often see poor gut health in people with multiple sclerosis or with autoimmune conditions in general, and that may need to be addressed as well to improve the absorption of the omega-3s in this case. But interesting to note that not all trials come up with the results we expect, and in this case, we would want to look at this in a lot more detail. But again, very important for cognitive function and omega-3s overall. I think if you've listened to this podcast all the way, you'll probably be going out getting your high quality. Don't get the rubbish 200, 400 packs from the chemist that cost next to nothing. You've got to get high quality fish oil supplements or clinical lipids. That's very important. All right, I'm about to run out of time. So what have we got left? Okay, Silymarin protects against kidney damage? Question mark. We often use Silymarin. I mentioned Silymarinum, which is the full herb name of milk thistle, in the liver study. In here, they're looking at with kidney damage, and we'll just go straight to the punchline here. Although creatinine is a useful marker in kidney damage, it's imperfect. For example, Silymarin might have a lowered creatinine for reasons other than protecting for the kidneys, such as increasing creatinine excretion. Okay, so what they're arguing here is that yes, it looks like because it's lowered a marker. In this case, it's creatinine levels. So it could very well be having a positive effect, but it may, through other mechanisms, be lowering that marker that's not having a positive impact on the health outcomes. So again, you have to look at the broader picture, but it could be an option rich in bioflavonoids. So what it's doing for the liver on a cellular level, maybe it might carry over to the kidneys as well, which would be really exciting if we found that milk thistle had this use for treating kidney disease as well. All right, so now one thing I haven't discussed yet, and what I might do is jump to that, and then we might finish on this one here. And I think I've covered everything I said I was going to discuss. One thing I want to talk about is, again, out of this journal here, the Advances in Integrative Medicine, we have this study on basil and the treatment of the basil species. Again, I'll try and get this as a digital copy and get it into the notes. So that's that research there. And this is looking at basil in the treatment of diabetes specifically, I think, and metabolic disease. And it's a review, and they've looked at a lot of different studies here. Type 2 diabetes here. Results of the review showed basil leaves are effective in reducing diabetes-related markers such as hemoglobin A1C, blood glucose levels, oxidative stress, insulin resistance, advanced glycated end products, and in improving insulin sensitivity, pancreatic beta cell functions, lipid profiles in diabetes. So they conclude here with the review. The review suggests that basil leaves have anti-diabetic effects in humans and animal models, and it may be used in the prevention and management of diabetes. So pretty strong conclusion to draw on, and it goes into depth, quite a lot of depth here too. So we're looking at different things here, and I'll definitely try and get this scanned or digitalized, because there was some interesting findings all throughout there. So basil, I use holy basil a lot in my clinical practice, and it's a great herb for anxiety. It's classed as an adaptogen herb. It has really good antimicrobial properties. Again, using it seems to not be too damaging to beneficial flora, and I've used it for great success with a lot of my patients. This meta-analysis here is particularly looking at basil, quite a few different species, and a broad look being a meta-analysis. Now, it's not going to have the same effect as a alcoholic-based tincture or ethanol-based tincture that I use, or fluid extracts that I use clinic. But adding these herbs and spices to your diet have profound effects on your gut microbiome. And if you can just get into the mindset of thinking, okay, I'll just have what herbs? Well, can I put a bit of oregano on here? Can I put a bit of thyme? Can I get basil, especially if you can get it from the garden? If you start getting into that mindset, it'll help have really, really big benefits over the long run. And I often recommend, after I do microbiome analysis and microbiome testing, and we're going through, and I might have to do some antimicrobial treatment or balancing the gut flora, I will be 100% recommending herbs that you can use in your diet, just to get all the rich polyphenols and everything that you can get from these herbs, and different things like herbal teas as well. And it's something you can add to your weekly routine. You start trying these things. Aim for adding some herbs and spices into your diet and some herbal teas, a couple of times a week. Just go, and that's, tick that box, and then try and learn a little bit more about it, add a bit more, and before you know it, you'll have herbs in your daily life, and it will make a huge difference. And you don't need supplements. If you've got your diet, lifestyle on track, and you start bringing in herbs from the garden, if you can even get out into a garden or a garden bed on your balcony or what have you, it'll change your life dramatically. So bring herbal medicine into your life. If you take anything away from this podcast, it'll be get onto some omega-3s, or make sure your omega-3 levels are adequate, and bring herbs into your world. So let's jump back to one last study from examine.com. And this is relevant to what I was talking with my co-host Shannon, or sorry Shannon, if you're listening to this, my fellow naturopath, I'll say, Shannon Burford, who we did the podcast with last week, and we did it on mindset and autoimmune disease. And mindset is very important for healing and health. And if you're not really aware of whether it's just internal dialogue being right, or what you're carrying with you what filter you're seeing the world through, it's this is all about mindset, setting the stage right. And we talked about how you often see these people that are really battling in life, got a lot of crap they're dealing with, but they're so positive and they just get on with it and move through life and everything. And I think it's very important. After we did that podcast last week, I had some really big challenges, like car breaking down sort of challenges and things like that. And I was like, all right, practice what you preach, Brad. Practice what you preach. And I had to work on my mindset, and I ended up what I could have ruined a camping trip with the family. but I think we came through it pretty well, and I dealt with my problems in a lot better way, a lot more functional way, by being in the right mindset. All right, so what we've got here is mindfulness improved migraine by small amounts. All right, so we've got modest findings here. In this meta-analysis of 14 randomized controlled trials, 1,027 adults, so a decent size, who were diagnosed with migraine headache, mindfulness improved migraine frequency and intensity by small amounts. Mindfulness interventions often consisted of 90 to 120 minutes per week of mindfulness-based stress reduction performed for 8 weeks. Okay, so 90 to 120 minutes. So this is kind of going out of your way, doing something like meditation or some sort of particular practice, and that's great if you can do that. But mindfulness and mindset do not have to be time that you set aside. It could be just writing down in a journal, just resetting. It could be the walk from your car to the office. Just pick a little time where I'm going to reset. I'm going to think about things in a whole different light here, and I'm going to be positive, and I'm not going to be reactive when I walk in through that door. And that can be a way of practicing mindset too. So there's always a way, and there's always room for improvement. So in this particular one here, Examiner.com crew, they say people with chronic pain conditions such as migraine can have thoughts and feelings that can originate from their pain and can amplify their physical and mental pain. Pain catastrophizing, they call this. Mindfulness, although it requires a significant time commitment and sustained effort, builds present moment awareness and can reduce this pain amplification. And that is the key here. So bring present mind awareness and reducing the amplification of pain. And we see this in so many conditions, and often I have seen strategies of people using things like technology where they'll go to a game or something to take their mind off the pain and so forth. How about you try and work on within your mind yourself and try and focus, use breathing, use any means necessary to calm yourself, to reset your mind, and create this positive filter and outlook that you can then utilize to get through your day. And I promise you, if you do any sort of mindfulness practice, you will see benefits, especially in the long run. All right, so a lot there. Hope you got something from what I discussed there. And omega-3s, make sure your omega-3 levels are adequate. The herbs are fantastic. I hope to do a lot more discussions on herb, not just research, but what I see in clinical practice, and every practical application you can use herbs for. Also, mindfulness, again, reiterating the previous podcast, which I will probably put right about there. And so if you're watching this not live, and the next day or follow on, there will be that podcast right there where Shannon and I go through mindfulness, mindset and autoimmune disease, and mindset and health in general. So